available to you later. Our final speaker this morning is Dr. Connie Noll, who is a psychiatric mental health nurse practitioner. She currently practices at University of Maryland Upper Chesapeake Health in behavioral health consultation and inpatient services. Prior to this, she worked for many years in community psychiatry at the University of Maryland Medical Center right up the street. And she's a volunteer at the Red Cross, and if you ask her, she has some tremendous stories about the time she spent, I remember this, in New Orleans following Hurricane Katrina. I leaned over to her maybe even an hour ago and said, some of this information is depressing. I mean, it's very, very impactful, and she said, the purpose of my talk. Her talk is on wellness and principles of recovery.
Thank you. I have to say that it's a great privilege to be here today. I am humbled and honored to be a part of this. My topic today is about mental wellness, and I have a couple of objectives that I want to address. One is, and I think Donna sort of just alluded to this, is that we've been talking about things that are symptoms of illness. And what I want to talk about is how do you tell, in a very broad sort of way, when is something normal and when is it a symptom of an illness? And the most concise answer to that question has to do with how much function the symptom or the phenomena interferes with your life and how long it lasts. There's all these things I'm going to be talking about are very complex, and I could probably speak an hour on each slide, but I'm going to have to try to move on that. I want to talk about a little bit about what happens in life that we all have to deal with that's not necessarily part of an illness, but can cause some of the same sort of symptoms. And then I'll begin to talk about how do you make your best self every day? What are the concepts of a wellness toolkit? So those are my goals for the next 30 minutes, and then I'll be happy to take some questions. First of all, I didn't talk to Dr. Jameson this morning, and she did mention animal discriminations. And I'd like to just throw this out because I think we have to think about the words we use and how we speak every day, and how many people say in passing, "You're crazy," "I'm crazy," or "I'm feeling so bad I'm going to shoot myself." So these are things that on my end of the world we take very differently, and I would challenge people to think about their language with what they refer to as something that's different from the norm. And I would like to say that there's a way to reframe the cow that's hanging from the tree, is that they've learned far more skills. They've learned how to climb trees. They've learned how to defy gravity. They have a totally different perspective of the world, and they've mastered speaking English. So the brain and behavior are very complicated. We've gotten that from the talks this morning. But what I would like to say is that as a clinician and in research, we understand a lot about what we call the bottom up and the top down. We don't know much about the middle, but we're learning. So what I mean by that is we know a lot about the intracellular level of the brain and how medications work and what happens with neurons and how they communicate and how that ends up into some behaviors. We also know something about human nature, what is typical human behavior, but we don't know is what goes into people's judgment, what goes into people's motivations. How do some people have such resilience and others don't have that much? Or what about hardiness? Some people seem to thrive on conflicts and do well with it, and others don't. Human beings are very complicated. We're the same in many ways, but we're also very different. There's many variations of what could be considered normal, and there is no real yardstick of this is normal and this isn't, except in some of the extremes we heard about this morning and what is a law. So it's all about, in some ways, context and perspective. So you've seen the story about the people who are blindfolded and they're all taking a different part of the elephant, so they think it's something different. I want to let you know that I really use that every day, because when I do an assessment, I'm very well aware of the fact that I'm probably looking at one of those pieces, and that's why I value people's families, people's significant others, and I respect that I only see a person for a very short time. Perspective, I had a wonderful mentor who said, you really can look at the same thing and have two different people say totally different things, and they both can be right. It took me a long time to understand how that would actually be able to be happening. But I want to tell you a little bit about my perspective. And some of it comes from working in disasters and the Red Cross. Because when you go to a disaster and people are all surviving a catastrophe, what you look for is not pathology or not symptoms. You look for what the function that they can do is, and you build from that. That got me thinking well over 20 years ago about what we could do differently in terms of being providers. The other thing that is sort of dovetails with that is the whole notion of the recovery movement. Because you look at how can a person do well in life no matter what they're dealing with. And so I think that's really important, and Dr. Curtis Adams talked about that in terms of treatment. So this slide could be a college course, and I have about 30 seconds to cover it, but we did talk a little bit about norms in terms of age. And so just as an example, we talked about I think it was Dr. Adams again, who said something about all the gray hair in the room. So I want to let you know in the morning, when I look in the mirror, this is silver. This is silver, okay? So all about how you reframe and redo and think about things differently. And I will say this, because we are living in an extreme political environment, and I want to say that what I want, hopefully, people to do is not to lose their humanity, to think about empathy and connections between human beings, and I'll just leave it at that. So it's all about function, and yes, I'm anxious, so my mouth is dry. So it's all about function, and what I'm going to do is talk about several areas of function. And I want to say that most people sometimes have doubts about their own self. And they think, well, that person looks so healthy, and that person has achieved, and that person has done this, and I'm not like that. But the truth is that every person struggles with something at some time. That's why the statistics about the need for mental health, in addition to having illnesses that need to be addressed, that's why some people could use treatment at any different points when they're dealing with crisis or developmental issues or something like that. So the basics, and Grace alluded to this in terms of the vegetative signs, are sleep, nourishment, and exercise, the things that affect your body. I think there's a single thing that can improve mood for most people who are not in need of medications for depression is making sure they get an adequate number of sleep. And he talked about that this morning in terms of the disc jockeys. You keep them up for several days, they can get psychotic symptoms. Nourishment also, I would add, think about the substances that people put in their bodies, because people will look for maybe some unhealthy ways of nourishment as a self-soother, and I'll talk about that more later. So some other aspects is relating with others. I think relationships are truly like the hardest thing in life. We spend our whole lives trying to master them and have them be a part of what supports us and nourishes us and makes us feel like we're connected to others. And they're also a very important part of productivity. Another thing is the whole diversion aspect of life. We are human beings. We want to have enjoyment out of life. We want to have fun. We want to have pleasurable activities. And sometimes people who are in stress or having difficulties or having illness symptoms don't give enough time for this, or perhaps they give too much. But it's an important part of keeping yourself on an even keel and being your best self. And the other aspect has to do with what I would call the big picture, which is the whole questions of what is the meaning of life, spiritual beliefs, and purpose. So the quote here is from Pablo Picasso. I don't know if you can see it that well on the slide, but it says, "The meaning of life is to find your gift, and the purpose of life is to give it away." So some people deal with thinking about these things all the time, and some people never hardly think about this unless they get to a crisis or a catastrophe or something like that. So life always brings challenges. Part of living means that there's change and emotional pain sometimes. I mentioned about developmental stages and changes. Moving from adolescence to adulthood is a huge one, but there's also challenges at each stage of development. And there are catastrophic events that happen. And I will say this, because all the literature about disaster and recovery has to do with the fact that it's not necessarily what happens to you, it's how you deal with it. Because I have seen personally people who have had horrendous things happen to them, and they are resilient. And those are the people that kind of keep me going, because I want to also say that, the doctor who spoke about the violence spoke about the emotional abuse as a child in terms of the increased emotional abuse of a child, increased the return visits for the violence. But an important perspective from that slide is also that 75% of people who had emotional abuse didn't have this. And 89% of the control group didn't have this. So we have to keep in mind that there are many people who have dealt with adversity and poor circumstances and have done really well. So a little bit about the signs of stress is similar to some of the symptoms we saw earlier, feeling physically and mentally drained, having trouble with focus, being easily frustrated and irritable, feeling tired, sad, numb, lonely, or worried, and then experiences those changes in the function. So everyone gets stressed, and everyone can have these symptoms or these phenomena. It doesn't mean that you are ill. It means that you're living and you're adjusting to things that happen. And again, you may have an illness on top of it, or you may not. But it's the level of function that gets disrupted, as well as the duration of how long that disruption lasts. So what are the things that you can do? Well, we all have self-soothing behaviors. And I like the Linus and the blanket. Not too many adults run around sucking their thumbs and holding a blanket. And that's a good thing. So, and one of the things I would just throw out there is have your self-soothing behaviors, or what you do, have they evolved as you've aged? Are they becoming healthier, or are you choosing things that may interfere with your ability to function? And then depending on the life circumstances, I mean, everybody experiences the loss of a loved one at some point in their life. And there's a need to have a new normal in terms of a coping mechanism, because some things that happen mean that things are never the same. So, the wellness toolkit. So what makes you be your best self every day? When you have a great day, if you've examined it, what were the ingredients? What makes you feel like you can deal with almost anything? What are those components? And so I think a good example of thinking about this is if you work with a group of people, and sometimes that group of people can change of who's exactly there every day, you walk in sometimes and you feel like, oh, we can accomplish anything today because this is a great group. That's what we might want to think about in terms of what you would strive for in like workplace relationships. But your personalized wellness kit is made up of all these things that you've identified that are individual to you, of what makes you have your best day, what makes you be your best self every day. So this is a combination, again, of sort of thinking about a wellness kit as well as psychological first aid principles. So what is the basics? Back to the basic function. How many hours of sleep do you need to be your best every day? Well, that's the plan for your every day. That's, you want to be your best? Get that number of hours of sleep. What is the balance in your nutrition? What's the best hydration? What's the best for you? And exercise. Get active. Do what you enjoy. Also, for relaxation and diversion, you need to make time for the things that give you joy. One of the things that I always do is that I have a long commute, and so I really appreciate nature, even as it passes by quickly. I enjoy sunsets, sunrises. I like the colors in the sky. I like seeing the different flowers bloom, and that's just me. You might have your own ideas about what things you like, what things make you think about how life is good. And relaxation. So, you see a lot of different things, meditate, yoga, massage. Some people hate massage, some people would never do yoga. You need to sort of explore and figure out what's best, what do you really love, and make time for that in your life. And then I do think there's spirituality, nourishing your soul, even if you're not religiously inclined. I think that there's a component that is that deeper meaning in life that people yearn for putting something in. And I think that one of the things that gets people into trouble, and gets people into trouble in terms of sleep, is at the end of the day, when you're trying to go to sleep, you ruminate and think about everything that's bad that happened. I should have done this, I didn't do this enough, I didn't do that, or, that didn't go well. And how can anybody fall asleep if they've got all that on their brain? So what I do, and I've recommended this, and I've never had anybody come back and say, Connie, that was a terrible idea, is that I make sure that I bring up everything that went well that day. And I replay it like a tape. This went well, this went well. And even if it's the worst day, I'll think about things that I'm grateful for. And I can always come up with those. And what I found, and other people have told me, is that doing that is good to help you sleep, but it also makes you wake up feeling very refreshed. So when you know you're stressed, Stay connected with family and friends. And if you need to build that network, then work on building that network. You need to have some patience. If you're going through one of the things that we know is life problematic, or a catastrophe, or a high stressor, or a loss of a loved one, other people around you are probably affected as well, so be patient. And also, take tasks small at a time. Don't think of the whole uphill climb you need to make, but take small steps towards that goal. And again, try to stay positive, reframe things as positively as you can. If you have a friend who can really reframe things for you, use that person. If your self-help is exhausted and you're still feeling the problems, then that's the time to reach out for professional help, for sure. So what are the outcomes for positive wellness? It should improve people's judgment. There's growth, becoming more wise about life and what you're doing, and you should have better decision making. Because life also brings all these things: joy, laughter, happiness, and satisfaction, even if you have a mental illness, even if you're dealing with horrible things that other people haven't had to deal with. Life also brings these things. And so I found this poem, and I thought it would be perfect for this topic. It says, life is amazing, and then it's awful, and then it's amazing again. And in between the amazing and the awful, it's ordinary and mundane and routine. Breathe in the amazing, hold on through the awful, and relax and inhale during the ordinary. That's just living the heartbreaking, soul-healing, amazing, awful, ordinary life. And that's breathtakingly beautiful. So, I've covered a lot in a, all right. I've covered a lot in a very short span. I know I haven't done justice to many topics that I've tried to cover. I am available at lunch, and Janice and I, who you've seen at the microphone, are doing a recovery workshop this afternoon. So I'll be happy to take some questions. And I'm way early. I thought I had less time or something. So I've left you speechless? Or hungry? Okay, thank you.
Thank you, Connie. Well, I feel that we've had a terrific morning, starting with a magnificent dynamic speaker. We've addressed some of the issues, symptoms related to mental illness and substance abuse, and then we had Connie uplift us and give us some thoughts as to how to keep ourselves well.